Let's get into First Principles Daily, episode 28 for July 3rd, 2026. Closing the week with one more look at where the next 10 times is hiding. A century after insulin's patent sold for $1, vials still list for hundreds despite raw material costs in the low single digits. A single vial of analog insulin that reaches a pharmacy counter at several $100s contains a few dollars worth of amino acids, salts, and growth media when the atoms are counted at commodity prices. The gap is not explained by the chemistry of recombinant protein production, which has been scaled for decades in other biologics. Instead, the price reflects layers of regulatory exclusivity, device patents, and distribution contracts that sit on top of the molecule itself. That separation between the physical floor and the observed price is the opening for first principles examination. The surprise grows once the manufacturing sequence is laid out. Engineered cells ferment the protein, chromatography isolates it, and sterile filling packages it, all steps already performed at industrial volumes for comparable molecules. The difference lies in what happens after the vial is sealed. Insulin manufacturing begins with engineered E. coli or yeast strains that express the protein in large bioreactors. This is followed by purification, formulation, and filling into vials or cartridges. The process itself is mature. Comparable therapeutic proteins are produced at industrial scale for other indications at far lower unit costs once volume and competition are present. What keeps insulin prices elevated is a set of institutional overlays that have accumulated since the 1980s. Evergreening through incremental formulation changes and new delivery devices has allowed successive layers of patent protection even after the original recombinant patents expired. Pen injectors, in particular, carry device patents that extend exclusivity years beyond the drug substance. Pharmacy benefit managers negotiate rebates that are opaque to patients and that favor list price inflation, followed by confidential discounts. State and federal regulations on biosimilar approval pathways add further delay. Although an abbreviated route exists, demonstrating similarity for a biologic still requires substantial clinical data packages. The result is a market in which 3 originator companies have maintained dominant share for decades, with limited entry by competitors. List prices in the United States therefore reflect these accumulated frictions rather than marginal production expense. Hospitals and insurers see net costs after rebates that are lower than the sticker price, yet uninsured or high-deductible patients encounter the full amount. The system stabilized around this equilibrium because each participant optimized within the existing rules rather than questioning the rules themselves. One objection often raised is that safety demands these controls. Yet other recombinant proteins reached lower unit costs under the same FDA framework once patent and reimbursement barriers were lower. Another layer is the specialized filling equipment required for cartridges and pens. Lines must be validated for each device format, and those validation costs are recovered across fewer units when competition is limited. Carrying costs compound because inventory sits in a distribution chain whose contracts reward high list prices. Each of these steps adds real expense inside the current frame, but none is required by the fermentation or purification chemistry itself. A rough magic wand estimate begins with the primary inputs. The insulin molecule itself is a 51 amino acid peptide whose constituent amino acids at bulk commodity prices amount to well under $1 per gram. A typical vial contains roughly 1,000 units, or about 36 milligrams of protein, so the amino acid value sits on the order of a few cents. Growth media, salts, water for injection, and excipients add perhaps another $1 or $2 when purchased at industrial scale. Downstream processing, chromatography resins, filtration membranes, and energy for bioreactors and lyophilizers adds further cost, but these are amortized across thousands of liters of annual production in existing facilities. Published analyses of contract manufacturing for similar monoclonal antibodies and therapeutic proteins place fully formulated bulk biologic drug substance in the low tens of dollars per gram at commercial scale. Applying that benchmark to insulin yields a finished vial cost estimate in the low single-digit dollars once filling, stoppering, and quality release are included. That places the magic wand floor somewhere between roughly $3 and $8 per vial under current technology, with the exact figure sensitive to volume and facility utilization. Against a U.S. list price that has ranged from $100 to $300 or more in recent years, the implied idiot index therefore lies between roughly 15 and 100. To arrive at that range, divide the observed list price by the estimated floor. $100 divided by $8 gives roughly 12, while $300 divided by $3 reaches 100. The gap does not reside primarily in the bioreactor or purification suite. Those steps have already been driven down by decades of biologics manufacturing experience. Instead, the largest increments appear in regulatory and legal overhead, in the specialized filling lines qualified for pens and cartridges, and in the distribution and rebate machinery that sits between manufacturer and patient. Each of these layers adds cost that is real within the current institutional frame, yet is not dictated by the physics of protein synthesis or the thermodynamics of fermentation. An objection sometimes offered is that quality control testing itself is expensive. Yet the same testing burden applies to other biologics whose prices have fallen farther once market entry increased. The arithmetic therefore points away from the reactor and toward the rules that govern how many reactors can operate at full utilization. A redesign effort would therefore begin by separating the molecule from its surrounding apparatus. The first concrete target is regulatory, establishing a clearer, lower-cost pathway for interchangeable biosimilars that treats insulin more like a standardized therapeutic protein than a novel biologic. The second target is device independence, decoupling the drug substance from proprietary pen mechanisms so that lower-cost vial and syringe or standardized cartridge formats can compete on equal footing. The third target is transparency in the supply chain, requiring that net prices after rebates be visible at the point of sale, which would reduce the incentive for list price inflation. Each of these moves requires policy or contractual change rather than new chemistry. The genuinely hard constraint is demonstrating long-term safety and immunogenicity equivalence at the volumes needed for diabetes care. That step cannot be wished away. Yet once equivalence is accepted, the remaining cost reduction follows from volume, competition, and the removal of artificial scarcity created by patent thickets. The prize is a price trajectory that tracks the established learning curve of other recombinant proteins rather than remaining anchored to legacy distribution arrangements. A further practical requirement is that any new entrant must secure reliable bioreactor capacity without triggering fresh device patent litigation. That sequencing matters because capacity alone does not lower price if exclusivity on the delivery format persists. Policy changes that shorten clinical data requirements for interchangeability would also need to preserve post-market surveillance so that any rare immunogenicity signal can still be detected at scale. When the dominant cost of a molecule lies outside its atoms and its reactors, the redesigned target shifts from the production line to the rules that govern entry and reimbursement. The second principle is that an idiot index measured in tens or hundreds signals an institutional rather than a materials problem. Only changes to those institutions move the price measurably closer to the floor. Consider what that means in practice. If the physical inputs and the established manufacturing steps already sit at a handful of dollars, then every additional layer of exclusivity, opacity, or specialized validation is an accumulated friction that can be examined one by one. The same pattern shows up whenever a biologic or any other engineered product carries an idiot index well above 10. The question becomes whether the next reduction comes from a new reactor design or from a rule change that lets existing reactors run at higher utilization under genuine competition. That distinction matters because the first approach improves the atoms, while the second approach improves the market that surrounds the atoms. In the insulin case, the arithmetic already points to the market side. Tomorrow, the show examines another domain where the same separation between physical cost and observed price creates an opening for first principles work. Who will be the first to publish a transparent, high-volume biosimilar insulin cost model that regulators and payers can actually use? That's First Principles Daily for today. If this changed how you see what things cost, share it with someone who'd appreciate it, and subscribe wherever you listen. I'm Patrick in Vancouver. One example or one opportunity every day. See you tomorrow. And if you'd rather watch than listen, find us on YouTube at Nerra Network. Links in the show notes. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own. I'm about to prove